Welcome to the Fit as a Mama Bear podcast. I'm Shelby, a certified strength coach, nutrition coach, mama to two, and all-around health nut. This show is about a little bit of everything healthy, fit, and natural related. So if you're striving to smash goals, eat better, feel better, and enjoy the occasional mom rant, this is the place for you. You're listening into episode 9 today, where I'll be chatting pelvic floor health, specifically leaking postpartum, with my friend and fellow personal trainer, Terryll, from the Barbell Balance. All right, so thanks for listening in today as we touch on one of the biggest topics that is horribly addressed, peeing your pants. Really, there's so much more to it than that, but let my friend here explain it all to you. So here with us today is Terryll from the Barbell Balance. She's a mama, a wicked PT, and my personal go-to for any pelvic floor related questions. So why don't you introduce yourself and tell us a bit more about how you kind of got into pelvic health?
All right, well, thanks for having me here. This is really exciting. The podcast is that nobody cares what I look like because they're not. It's like the radio, right?
Yep, so, that's pretty much the perk of life for me right now.
I hear ya. So yeah, as you mentioned, or as Shelby mentioned, I'm Terryll, the founder of the Barbell Balance. I work with women really of all ages and stages of life who are learning to manage their pelvic health through high impact exercise. I got into this actually when I was pregnant with my second, so I'm a mom of 3, so my second, at 18 weeks pregnant, I had horrible pelvic pain. It felt like I was just getting kicked in the crotch.
Oh my God, that's terrible.
Oh yeah, and I spent most of my pregnancy on the couch. It hurt to move. I couldn't dress myself. Going down the stairs was a nightmare.
And you had a toddler at home too at the time, so
I did.
Functional.
Well, I introduced him to YouTube.
A mom savior right there.
Yeah, it did. I would put YouTube on and I would just sit on the couch because it was the only place I could be where it didn't hurt. So yeah, life was really hard, emotionally as well as physically, obviously. And it was just dismissed as normal. Well, your body's just preparing for birth. 18.
Wonderful.
Yeah. 18 weeks pregnant, rest of my pregnancy like this. And I did, and it got worse. So I was very grateful when she was born and I could get up and walk without.
No doubt.
Yeah, I felt better when she came out than I did when she was in. But I found that the most disheartening thing or the most discouraging thing throughout the whole process and that pregnancy was it was dismissed as normal. Which it's common, many women experience pelvic pain during their pregnancy. For some women that resolves after birth. Some, they carry that on well into years postpartum. And, for women like me who like to be active during any stage of life, being forced to be immobile it was eye-opening for one, but it's emotionally
on them. Like,
yeah,
I don't know. I don't know how I would handle that.
It was tough, but YouTube, like I said, but that's when I started learning about pelvic floor physiotherapy, and that this in fact wasn't something that that you had to live with during pregnancy. Now, unfortunately for me, I didn't get in to see a pelvic floor physiotherapist until I was 33 weeks pregnant.
Oh, goodness.
Because it was still relatively new here in London, and the ones that were here were fully booked. And many of them are moms themselves, so they're not working full-time hours. So yeah, I couldn't get into about 33 weeks. And by then,
it was just sheer pain.
So I got, but the blessing in that is that it brought me to this place here in learning about pelvic health, the importance of it during pregnancy, postpartum, through menopause.
And now helping other moms learn about it too. because it was actually you who got me to go to my first pelvic floor physio appointment, which I do have a blog post on it, so I'll drop it below, but I had never even heard of a pelvic floor physio. And I think what makes me so mad is I'm a certified strength coach, and that is never mentioned. Like in all of the certifications that I have taken at that time, it was never mentioned to go to a pelvic floor physio and get checked out, and it just wasn't talked about. And I think that frustrates me so much more than anything else, because it was eye-opening.
Yeah, and the training that we get as strength coaches, personal trainers, fitness coaches, it's all geared to men.
It is
for men's bodies, and women's bodies just aren't considered in those trainings. And yeah, the conversations are starting to open up, but you would be surprised with how many women still put up with pain, pelvic pain, stress urinary incontinence, so they're peeing during their workouts or when they laugh, sneeze, or cough, running after their kids, or even just, having a pelvic organ prolapse. They just deal with it because the conversations, like I said, it's common for me because I talk about vaginas all day. For other, but for the majority of women out there, they have no idea that there's help for this stuff, right?
Which brings us into today. So eventually, I think I want to have you on the show again, because I do want to chat specifically about prolapse and kind of what to do if you think you have one, and just the myths of diastasis, because that's a really hot topic right now for moms also. But today I wanted to start out with the basics for other moms who just don't know that this is something almost all moms experience at some point, and that the majority of people assume peeing or leaking is normal postpartum, and that goes for many years after. I know a lot of moms the generation above me, so my mom and grandmas, will cross their legs if they sneeze and just say, oh, I just have a weak bladder. So it's not just immediately postpartum that this is present. So that being said, if we're looking at kind of the immediate postpartum, or I guess a close postpartum range, what causes leaking?
Well, you pushed a baby out, if you've
vagina expanded.
Well, it's got to stretch, and those muscles don't just bounce back after baby's born, right?
Myth blown right there, everyone.
Yeah. But yeah, even during pregnancy, your pelvic floor muscles, your vaginal muscles, the muscles that support your bladder, those muscles become stretched because they're making way for you to birth a baby. Not only that, there's pregnancy hormones that are in there, primarily relaxin. They don't go away just after baby's born. Relaxin can stay in our systems for 3 to 6 months after we're done weaning.
And I was going to say, longer while you're breastfeeding, relaxin will still be in your system, I do believe.
Yeah. I mean, this all varies woman to woman, but, our pregnancy hormones, like I said, they just don't go away. They change, sure, after baby's born, but now, if you're choosing to breastfeed, your body is adapting to that. You're likely a little bit more stressed after baby's born, because there's a lot of change happening within your own life, your family's life, relationship changes. That's a lot to happen all at once. Your sleep, like if you're waking up every 2 hours to feed a baby, your body just functions differently, right? Your recovery might take a little bit longer.
So one thing I think it's important to note too is it's a common misconception that this should only happen if you have birthed vaginally. And as we just explained, it's not just the actual birth that causes leaking or that can cause leaking. There's a lot of other factors involved postpartum. So even C-section moms are going to experience this and going to have to kind of see a pelvic floor physio and kind of focus on that. It's not just with a vaginal birth.
Oh, exactly. To speak to the C-section women, I had 2 vaginal deliveries and a C-section, so I do come from experience here. For many women that have a C-section, typically unplanned, they still do labor, right? They may go through a pushing phase where, you know, pushing down onto your pelvic floor is going to impact it to some degree.
And
right?
so it's just stretching to accommodate the baby as it's descending.
Right. You know, and it's still, those hormonal changes are still taking place. So, you know, when I hear, well, I've had a C-section, so this doesn't apply to me, it applies to all women who have had babies.
Yeah, I'd say about the same. So that being said, should we eliminate jumping or running or kind of high impact exercises when we're pregnant to eliminate a risk postpartum? I know, very convoluted question right there, because that's a big, it depends, isn't it?
Yeah. And it really, generally speaking, I'll speak in general terms. You know, your pelvic floor is taking on a lot of impact during pregnancy.
Without
right?
movement, just in general.
Right? Like, I believe I just read a study, was it earlier this week? Well, I guess it's only Tuesday, but last week, where, I know, right? I'm lost. Where pregnant women, you know, their typically daily endurance is like that of running a marathon, right? So if you're adding running and jumping,
Top of that,
higher impact exercises, again, you know, that does place extra work onto an already overworked pelvic floor.
I think, I don't remember who said it, but the best way I ever had it explained to me, and it is one of those moments that I wish someone had cuffed me upside the head during one of my pregnancies. My second was better than my first, but definitely with my first, was the risk versus reward. So yes, you can definitely run, like you are capable of running. Your legs can carry you, and you might have to run a little bit slower, but you can probably get through it.
Yeah.
But is it worth it? Is to be perfectly honest. So I think sometimes just stepping back and evaluating, do you need to run today? If you're super tired and you're already stressed, pushing through that workout sometimes just isn't the best option. And it's okay to say no to the running or jumping. You don't have to always be a badass, which I think I just misunderstood with my first.
Well, you know what? I did too. But I think that's what brings us, we're slowing down here. But I think that's what brings us to this work, right? So, you know, I do say it does depend on the woman, and you're right, risk versus reward. Can I, should I? You know, if running is something that you want to do during pregnancy and continue to do, if you want to continue to do, you know, box jumps or double unders, well, let's be smart about it. You know, let's put together a strategic plan that is going to minimize those risks on the pelvic floor, right?
So it is possible to still do those things. Sometimes just modified.
Yeah, you can modify, scale it back. You know, and I would suggest seeing a pelvic floor physiotherapist throughout your pregnancy if you do want to continue to train at a high capacity, only because they know what's going on with our pelvic floors better than we do sometimes, right?
Well, and I think that's a good suggestion though too, simply because telling someone who loves fitness that all of a sudden they're pregnant, surprised you can't do anything, is a punch in the face. Like, it's just, it's going to cause more anxiety stopping everything for someone who loves what they do than it is to continue. So you do have to factor in that also. I just think that sometimes it's a matter of tweaking.
Well, and that's it, right? And prioritizing. Like, you know, it's also going, you know, where I coach my clients is, okay, what are your goals postpartum? You know, get them to look at the bigger picture. Because if they want to, you know, start training for a marathon at 6 weeks postpartum, 8 weeks postpartum, well, then let's plan for that, right? So
versus training for a marathon right now while you're pregnant.
Well, yeah, you know, let's maximize this time now to or yeah, like let's plan for your postpartum recovery now, so
Good
that
idea.
you do go when baby is born, you have all those life changes thrown at you all at once, and you're awake sporadically 24/7, you're likely not going to want to learn new skills at that point, right? So let's teach them to you. Let's learn them now while you're pregnant so that it's less of an effort and less of, it's less stress postpartum. So
Trying
that
to learn it.
gradually build up your fitness level when baby's born going forward, instead of having any major setbacks. Truthfully,
That's a good idea.
yeah, and truthfully, we can't always prevent some of these things, but we can minimize them the best that we can, so that, again, after baby's born, it's not a major setback. You're not, stuck in this rehab phase where, you're not happy because you want to be doing more. And I think that kind of, with a lot of women, especially active women who are fitness enthusiasts, athletes, they're looking at the right here and now. Whereas if you paint the bigger picture, it gives them something to think about.
Gives them light at the end of the tunnel, I think.
It does. And, this all takes time too, right? So
the big question then, can you fix postpartum leaking, or should we all just wear panty liners when we work out after having children?
So it can be treated, right? And the sooner that you can get into a pelvic floor physiotherapist and start that postpartum rehab process, the better off you'll be. Not to say that if you're 5 years, 10 years, 15 years postpartum and you're still leaking, that it's too late for you. You can treat it at any time. But if we're speaking just to new moms here, women that have recently given birth, that 6 to 8 week mark, there's a lot of healing taking place. It's common to have some leaks post-pregnancy, especially right after baby's born, because, those tissues have been through a lot. So going to a pelvic floor physiotherapist, 6 to 8 weeks postpartum, just to get a sense of how your pelvic floor is healing, will give you a little bit more guidance as far as how to address leaking if you have any. And then, again, where I come in is working with women who want to progress a little bit faster in that process. So finding a training program that works, where they're not leaking and then progressively overloading over, a period of time, right? So again, that's all really dependent on the woman, because some women, they don't have access to pelvic floor physiotherapy, whether they live in a rural place, financially, it may not be an option. They may not have coverage, benefit coverage for it, and pads may be their best option. So, we have to take that into consideration as well. But yeah, it is treatable. It can get better, and you can still absolutely continue to exercise in ways that you enjoy, without having to cut it out completely.
So you can kind of do both things at once. So when can you start rehabbing your pelvic floor?
So again, that may depend on several factors, like, your mental health postpartum.
Yeah.
How you're feeling emotionally. How well you're supported during, that early postpartum period, especially. So if you have lots of help coming in, it might be easier for you to rehab. But really, if I'm working with a woman who has recently, vaginally delivered a baby with, no complications, or medical interventions such as like forceps or a vacuum or an episiotomy, I will start her on just breathing and pelvic floor engagement or the Kegel, within a day or two.
Okay, so fairly soon after.
Fairly soon. I mean, this isn't going into exercise, but just, learning to reconnect the core, the pelvic floor with alignment and breathing. C-section women, that's going to depend on their comfort level, because, it's painful. And it's hard to move. But when I started my own personal rehab after my C-section, it was about a week, and I just started experimenting with my breathing and my pelvic floor engagement, my Kegel, my TVA engagement. So I do coach that as well with vaginal deliveries, just, bringing back that mind-body connection first. And then again, like progressively overloading. So, once that's down, then adding in movement or coordinating that with movement. But that 6-week mark, that's not necessarily permission to go hard again. We've got to retrain back into that. Right. So, you can start your postpartum rehab fairly early so that when you're, at that 6-week mark, you've gotten the clearance from your doctor. Your pelvic PT, again, would be a good idea to get cleared with a pelvic PT as well. You can then, pick up the intensity a little bit. But I, would suggest, at 3 weeks, you can start just light movements, right? Like glute bridges and body.
Okay, so going into those light movements, what would you say a few of your staples are? They're definitely one of mine.
Yeah. So with, so the first one I like to teach, and even with a woman who isn't early postpartum, a woman who is never, who she might be 20 years postpartum and has just never coordinated her. Oh, did it?
Oh, we're kind of freezing.
Oh, could you hear me there?
A little bit, a little jumbled.
Yeah. So even for a woman who's just learning how to coordinate her Kegel with her breathing and movement, I like to start with a glute bridge.
Okay.
Just because there's that, you kind of have that support of the floor, right? You can lay down, kind of catch your breath, I like the clamshell because it introduces a little bit of rotation, and as moms, we're kind of moving and rotating
all the time.
Yeah. And then things like body weight, squats and lunges. Again, for some women, this may all take place in a single session, and others it might take a few weeks, just depending on where they are.
Well, and I think it's not a matter of just doing those exercises, because those muscles should still function properly, but it's about reconnecting with your core activation during those exercises. So it's easy to pound out a bunch of squats and activate nothing or not feel anything.
Yeah.
I think the biggest note would be to reconnect your breath and your TVA and your pelvic floor while you are doing a squat, so that when you are ready to load up, those things are already in place. Cutting in here to give a quick shout out to today's sponsor, ProSource. When it comes to working out at home, most people struggle using just their body weight, unless you kick ass at pull-ups already. For this reason alone, I always send my new clients home with resistance bands, especially new moms. They're simple to use, low impact, and beyond cheap. I am Dutch after all. ProSource offers resistance bands and any other home fitness equipment you can need at great prices. I truly believe that working out at home helps you stay consistent. And while I do have a killer setup now, I trained for years using just bands, one kettlebell, and some suspension straps. Especially as a new mom, resistance bands are the biggest bang for your buck. You don't need a fancy setup, but having some options to train your body properly helps. Head on over to prosourcefit.com and save some money using code MAMABEAR15 and set yourself up, then stay consistent and smash some goals.
Right. And it's much more, it becomes natural as opposed to, okay, like I've got a couple of dumbbells, I'm going to squat. Wait, what do I do? You know? And then, yeah, like because your core, or I'm sorry, your pelvic floor is a part of a system, right? So really what we're doing is training that system.
To work as a whole.
Exactly. So, with your pelvic floor, I mentioned breathing, we're going to coordinate breathing with movement kind of thing. Well, we need our diaphragms to breathe, right? So
you don't say.
I know. you wouldn't have guessed, but anyway. So your diaphragm and your pelvic floor are two opposing muscle groups. So they work together, right? So what we're trying to do with the breath in alignment, so in a neutral, which is relative to people, there's no one perfect posture. So with the breathing, you're teaching your diaphragm and your pelvic floor to work together. With that being said, when we talked about the TVA, or the transverse abdominis engagement, so your TVA is working with smaller muscles in your spine known as the multifidus or multifidi in the lumbar spine. So we're teaching those muscles to work together. Now, when I say it's a system, all four of these muscles, so your diaphragm, pelvic floor, your TVA, I know I had to think about that for a sec, and your multifidi, your lumbar multifidi, they work together. And the best way to initiate how these muscles work together is through your breathing, right? So it all ties in, is all very important when rebuilding, retraining, rehabbing, what have you, your pelvic floor, and making sure that it's functioning well for when you do get back into exercise. Because like I said, it's during the early weeks, especially, or when you're just learning how to do this, for many women, it's exhausting.
Well, and you have so much more going on at the
right.
time to think of taking 10 minutes to learn to breathe sometimes.
Right. And, most people are like, well, I already know how to breathe. How do you coordinate that with your core and your pelvic floor, right? Like, it's a different skill set that, again, we don't learn in our certifications as fitness professionals.
No, we do not. And I'd like to point out too that learning that skill set isn't just for postpartum. It's if you take the time to learn to breathe properly and activate the muscles necessary, your lifts end up stronger, your running ends up stronger, everything ends up functioning better together, which makes a big difference from injury perspective and performance too. So it's not just for immediate postpartum females also. But that said, I also wanted to talk to you about the Kegel. So Kegels are a staple for pregnancy life, but they shouldn't always just be done in excess. So do you just want to touch on that for anyone thinking that they're currently pregnant and they're doing their 45 Kegels a day, and they'll do their 45 Kegels a day postpartum and they will be good to go?
Yeah, loaded. You're asking questions here. So when I was talking about pelvic floor engagement, it's a Kegel. We time it, or we coordinate that with our breathing. So it's not just, I'm sitting at a stoplight, relaxing and contracting my pelvic floor. There's a little bit more that goes into that than.
Which, side note, for my first pregnancy, I totally did. I was like, I can just do these in the car. It'll be great.
Yeah. Yeah. No, we've all been there. And, most women do that. So most women, we're taught that all a Kegel is a pelvic floor contraction, or the contraction of our vaginal muscles. Got a little tongue tied there.
It's an elevator. That's what I remember.
Yeah. So, but again, when I was explaining how the pelvic floor works in conjunction with the diaphragm as well as the TVA and the multifidi, we need to coordinate that with our breath and our alignment. So yeah, it's not just doing 100 kegels while you're doing dishes. However, kegels aren't right for every woman. So if women aren't being taught to do them properly, they may just be holding, I'm closing my fist here, because I talk with my hands a lot. They may just be holding their pelvic floor in a contracted manner all day.
And making it super tight.
Yeah. And this is also what happens to some women early postpartum, because they're, like I was saying before, that those muscles do get stretched. So, urine can leak through at times. So some women will just not sit there, but they can't make it to the bathroom because they're caring for a new baby. And they are contracting those muscles, and those muscles could be contracted for hours. So that's, so when there isn't a lot of movement there, yeah, those muscles become overactive, making it harder to relax them. So if you have an overactive pelvic floor, or a tight pelvic floor, adding kegels may not be right at this time. Only because if you're contracting those muscles, they're just going to become even more overactive.
And let's remember that part of contracting a muscle means both contracting and releasing said muscle, because even though it's a smaller muscle or it's an area we don't think of, you still want a full range of motion through those muscles.
Right? Like, we're not sitting there with our biceps flexed all day.
Speak for yourself.
Yeah, you want to come to the gun show? But so yeah, if your pelvic floor is overactive or tight, then just adding in more contractions, will only add to that.
Which I think is why seeing a pelvic floor physio is so crucial, because having a crazy tight pelvic floor isn't something we can exactly diagnose off the bat.
No, but there are things to kind of look out for. So if you're straining if you're straining to urinate,
okay,
and really hard to go pee, that may be an indication that you're having trouble with an overactivity thing within your pelvic floor. Some women experience lower back pain or hip pain because those muscles are
constantly.
What else? Leaking is another symptom. So we don't often think of, we think of contracting those muscles to protect against leaks, but really, they can add to leaks because the bladder isn't being supported as efficiently as it would be if it can both, contract and release, as you mentioned. Some women experience pain with penetration, so during sex.
Okay. Which is a common one postpartum.
Again, those muscles are yeah.
It can be a common postpartum anyway. So that's a bit of a tricky one.
It is, but
to diagnose.
It is, but it's just, something to be mindful of.
To be aware of. So if you're having these symptoms.
Yeah, I mean, some women experience only one symptom, some women have them all. Again, it's just very individual. But, if you are having pain with intercourse postpartum, there is help for that as well. Or at any point in life, there's help for that as well. But that's just something to take into consideration. What else?
So what advice then would you give to all expecting moms kind of about the postpartum pelvic health area? Because it's a big one.
It is. First and foremost, I think just First of all, getting assessed by a pelvic floor PT, because they can get an internal perspective of what's happening down there. That's beyond my scope of practice.
And it makes it a little bit easier to manage the symptoms and everything, knowing what the cause is.
Well, exactly, right? And, if they, can see what's going on, or if they can feel what's happening on the inside, that kind of makes my job a little bit easier. But, I think the biggest take home is just to be educated about pelvic health in general, whether you're pregnant, postpartum, if you're 50, 60, 70 years of age. I think it's something that can be empowering to all women. But, for pregnant women, being even educated on, your pelvic health in terms of pregnancy and birth and what happens, after baby's born. Because I think, we all seem to think that our bodies bounce back, or, we just recover in 6 weeks and, voila, but
does not happen.
no.
Which I'd like to just make a quick note here, because I hear a lot of this one, and for some reason it just makes my eye twitch a little bit, is everyone wants, quote unquote, their body back. And the truth is postpartum, you're never going to have the exact same body that you had pre-pregnancy. You can have an amazing body, you can have amazing performance, and you can do great things, but you're never going to be the exact same. You were pregnant and you grew a baby, and everything changed from that. So it's okay to find a new you and new performance and just a new way to do things. It is okay.
Yeah. And you touched on a really important point there. Our bodies don't bounce back, and I understand wanting that piece of yourself back. But what we have to do is remember that we need to find a new normal.
And it can be just as awesome.
I am so much stronger now, and I perform so much better now after 3 babies, after a C-section, than I did 10 years ago.
I think I'm in the same boat. And I think it's just because I think you learn something from every pregnancy. I think every pregnancy teaches you something new and new lessons. And so you just implement them, and you get stronger. And I'm personally more functional, to be honest. And I know you're killing CrossFit, so there's that.
Well, I think that's just where society really disservices women. Pregnant women, it's like this crazy, one extreme to the other, right? We, don't exercise during pregnancy. Okay, well, it's okay to exercise, so we're going to exercise extremely hard because pregnancy is a challenge, right? Nothing's going to get me down. And then, postpartum, I'm going to do wind sprints at like 3 weeks postpartum because I can. Where it's like your body is going through massive changes. You're making a baby, you're building a baby, you're birthing a baby, now you're raising that baby. We have to kind of take a step back and, remember that our bodies are different and so are our lives.
Very much so.
Yeah. And there is no going back from that. So, it's up to us to kind of learn to find something new, be accepting of where we are, and keep moving forward. Because I find so many women, I get messages every day from women who just say they feel broken, and they feel so lost. And
which breaks my heart. I understand it.
Yeah.
I totally understand that, because I think it's scary. I think your first pregnancy is just very, very scary because you just don't know what to expect.
Yeah.
So that there's that, and you are just very, very different. Everything has changed. Your center has changed. So it's hard to embrace that sometimes.
It is. And, it's perfectly normal to want, your pre-pregnancy performance or your pre-pregnant body back. But there's also something to be said with going too hard too soon. And that's not just in terms of pelvic health, it's just our emotional health as well, which does affect our pelvic health too, right? So
yeah, they're kind of interconnected, I guess the word.
We're humans.
Yeah. Now, looking at resources, if I remember correctly, you have not a lot of videos. You have a couple of videos on diastasis and kegels and whatnot. So if I'm going to drop those in the show notes for anyone who needs them, just in case you do need some more resources too. And I think that's all my big questions. Like I said, I kind of want to have you on because I really want to talk diastasis too, but that's a whole other ball game.
Yeah, you're opening another can of worms with that one. I've got some there.
So why don't you tell everyone where they can find you in case they do have further questions or want to work with you remotely. So Terryll does work online as a coach. And not just in person. So if you have questions, reach out to her. Because like I said, she's kind of my go-to on any pelvic health pregnancy situations.
Yeah, and there's a lot more. Yeah, there's a lot that goes into it for sure. So if I didn't answer any of your questions,
I'll have her back. I promise, everyone.
But yeah, if you have anything specific, please, reach out to me. You can find me on Instagram that's like at Terryll Bladock. Pretty easy.
Do you want to spell that?
I was just going to do that.
Okay.
It's TerrellBladock. So there's no space.
Perfect.
Or you can find me on my website. It's www.thebarbellbalance.com. And I've got a ton of videos there.
And they're really helpful, guys, like genuinely helpful, especially if you have questions about assessing diastasis and just different awesome drills for training while incorporating your pelvic floor.
Yes.
I love them.
Good. Well, I'm glad you do. And then I've got some stuff on YouTube, but I don't really do too much there. But it's Terryll Bladock if you want to see some videos. And
perfect.
But yeah, I hang out on Instagram mostly. So if you want to find me there.
You kind of dominate on Instagram. Your videos are fantastic.
Well, I like to have fun with them too, right?
You should do dance videos.
Yes. If you want to see some Oscar-worthy performances, I'm on Instagram.
Hit up our Instagram. Well, I think that about sums it up for today, friends. So I can't thank you enough for listening into the episode. I'm still baffled that I've already recorded 9 of these. And remember, if you're in need of fitness tips, workouts, and amazingly healthy recipes, you can check out my website at www.fitasamamabear.com. And obviously, you can hit up the show notes on my website to find and connect with Terryll if you have more questions. And if you're loving what you're listening to, please subscribe, rate, and share the podcast. Not only does this give helpful information to others who may not know where to find it, but it also helps me out too so that I can keep providing you with more. And on that note, you can check back soon to catch the next episode of the Fit as a Mama Bear podcast. And for all the ladies out there, book your pelvic floor appointments. Chat soon.